Hi, Dr. Morse, injury expert. So in between patients, I wanted to provide an update for Jalen Royals. We know the Rashee Rice suspension now, so we get some clarity. Now, what's going on with Jalen Royals? Super talented, very high on him personally. You can see his full injury profile and injury history in the injury draft guide if you want. But from an injury perspective, now he's dealing with something. So we can see from this tweet, he didn't play last week, and then we saw that he didn't practice basically in the past week or so. It's not super clear. He definitely didn't practice yesterday. And he's dealing with what we call patellar tendonitis or tendonitis of the knee. So realistically, what does that mean? So overall, this is not super concerning, but it's annoying. Now, there's a couple caveats here. So if I break out my knee model, this is usually an injury to the tendon that attaches to the bottom of the kneecap. So this is the patellar tendon. So basically, when you look at the knee from the side, the quad tendon and the patellar tendon play tug of war. Now, the patellar tendon, the quad tendon, and the patellar tendon, the quad tendon is usually stronger, so it usually wins. Now, what can happen is you can have repetitive micro tearing of where the patellar tendon attaches to the bottom of the kneecap, as that's where it's at its weakest point. Now, the tricky part is the mid body and the distal part usually never have problems. It's pretty much only proximally. And if you run like this, which is not realistic and not very common, but it can happen, then it's probably in the middle of the tendon. But if you run more of a medial tilt, you're probably going to have more wear and tear on the inside part of the tendon than the outside, being this is the outside of the leg. Now, the tricky part about the patellar tendon is that it doesn't always heal as quickly as you would like. I personally inject these under ultrasound, usually either with PRP or stem cells, to decrease the inflammation and help to heal the tissue. Now, one of the things that can happen is the fat pad underneath the kneecap can actually feel like this is patellar tendonitis, but it's actually a fat pad impingement syndrome. The other thing that we can often feel is, especially if Royals happens to have what we call a patella alta, which basically means that the kneecap rides higher in the groove. The problem is that patellar tendon now has to stretch a little bit higher. So it's under more tension and it is easier to start tearing. Now, this is more concerning than, annoying than concerning, but it's still not ideal. He's young, he should be healthy, and now he is dealing with a tendonitis that may bother him and prevent him from being super fast and explosive. Now, you'll often see runners who are dealing with this wear a strap right here to help decrease some of that tension. A lot of the times, like wearing an elbow strap for tennis elbow, similar concept. Now, I think he's going to be ready for week 1. I'm not overly worried about that. The tricky part is how much is this going to impact him on every single route? And what have they done? Have they done shockwave? Have they done PMF? They've done red light. I'm assuming they're doing physical therapy. Did they inject it with anything? Is this just tendonitis or is this a partial tear? So there's all these different avenues that we could potentially discuss depending on if he's just going to be good or is this going to linger and drive him crazy for the whole season. How much of a risk is he for partially tearing this patellar tendon? Mind you, this is the same injury that their new offensive lineman, Justin Simmons, suffered. He had a partial tear, likely. I'm assuming he didn't have a full thickness tear because he's already playing, that required surgery. So this starts, and that can result. Usually it's in the bigger linemen and the bigger guys as opposed to the smaller, faster guys. But nonetheless, something to think about for Jalen Royals, specifically for patellar tendonitis. More of an inflammatory condition, but you need to figure out why. And that's what really you need to figure out. So I still like him. I still like him as a deep dart. He might really benefit from Rashee Rice being out 6 weeks. But realistically, we need to get this knee healthy before I can actually trust him. I will give you more when we have more. Thank you for tuning in. We'll see you on the next video.